everyone. Hello, Olfat, Leah, and Nosheen. We're going to be talking about a range of subjects, healthcare disparity, disease, heavy subjects. I want to start with the positive. Olfat, at Roche, what is an area that you're particularly excited about right now?
First, hi everyone. It's a great pleasure to be here with all the great females on the stage and in the room. What we're really excited about is the innovation that is getting really increased by the day. It's be it on the discovery level, but as well on the technology. I mean, you cannot imagine the level of innovation that has happened in the past couple of years, especially with the digital, with the technology, with the utilization of AI, and how it's helping from drug discovery until the patient management, the last piece of the patient management. So it's really very exciting how it's helping us in our mission in creating a healthcare that is more predictive, more proactive, and more precise.
That's a great slogan of 3 Ps, which we're going to come back to in a second. Leah, I'm going to move on to you now. Cigna operates in, I think, around 30 countries.
Yep.
And you're very specifically focused on the Middle East and Africa.
Right.
You just got back from Nairobi last night / this morning, so thanks for being here. Where do you see the greatest health disparities right now in your remit?
Sure. I think it would probably have to be around prevention. So most people, not all, but most people have access to some sort of sick care. And that's fine. That will, help get people back to, a sort of more stable state. But I think typically only those that have perhaps either good social health care or good insurance will then have the coverage for prevention. So by that, I mean things like wellness checks, dental checks, things like this that really give people a proactive view. So I think we're all gonna be Ps today. That give people a proactive view into their health and also raise awareness and accountability for managing their own healthcare journey.
Mm-hmm. And so how do insurance companies like Cigna help close the gap there when it comes to disparities?
Yeah, great question. And actually, kudos to many of the governments across the GCC who now require health insurance to include preventive health benefits. So in our plans, we always have modules for prevention, and we do a lot of awareness and education around the importance of that as well. So things like we wouldn't, a preventive module wouldn't have a co-insurance on it because you don't want to put any barrier or any friction in place in encouraging people to make that step and go and get themselves checked out.
Nosheen, you are part of the new guard of healthcare companies' platforms. January AI uses AI, unsurprisingly, to give users personalized nutrition and blood sugar level insights. How do you hope this technology is going to impact the healthcare industry as a whole and patient outcomes?
Well, we have all the tools we need today to help make the world metabolically healthy. The numbers are staggering. We are going to have 1.3 billion people with diabetes by 2050, and about 3 times that number will have prediabetes. So you will have over 5 billion people, or half of the world population, will be insulin resistant by 2050. And the good news is that we have the technology today to actually help people live healthily. A huge problem that we have is education around metabolic health. People don't really know how foods impact their biology. And so AI has made it super easy to take a picture of a food, be able to see its macros, be able to see its protein, fiber, carb portions, and also using a technology like January AI to be able to predict your blood sugar response to it and not having to use any sensors. So we started 7 years ago developing this AI technology in-house, and we used sensors like continuous glucose monitors and smartwatches and user-reported data to build millions of data points across thousands of people. And now we're able to remove the sensors and be able to provide probabilistic blood sugar responses for everyone. If someone really needs it, if they're insulin intense, they can put on a continuous glucose monitor. But for the most people, for the most part, we're able to give them predictions, and that education using AI without using expensive sensors, increasing access.
And the app, the company is based out of Silicon Valley, is that right? And it's available in the US. Is it downloadable here?
It's downloadable everywhere.
It's downloadable everywhere. Okay, Leah, when Nosheen mentioned that figure about the number of people who are going to be insulin resistant, you look slightly horrified. Talk me through your reaction to that and what you were thinking.
Well, I mean, I think we all know that these endocrine diseases are prevalent and actually particularly in this part of the world. And I think that's, somewhat down to the sort of ecosystem, but also sort of education and awareness of just general healthy living. So I had it in my mind that we would be around 30% now. And I guess one would hope that with education and with fabulous tools like January AI and other, pharmaceuticals as well, actually, that you would be able to sort of dip that curve rather than seeing that rise to such an extent.
Yeah. If I can add to this as
course.
well, I think there are a lot of implications of diabetes and obesity as well. And I think in the Middle East, we have one of the highest prevalences in the world. And this is mainly due to the lifestyle and many other things. But what is very important is that we see the repercussions or the impact of this epidemic, if you want to say, on other health factors, like, for example, on eyesight and the challenges that the patients might reach in the future. And one very important aspect that we feel at this stage is how can we use technology to really understand what are the changes, for example, in the eyes that we can predict what could be the diseases, and at the same time we can intervene early on in the way of the disease manifestation. So utilizing the technology is very important aspect as well in the prediction and in the prevention of certain diseases.
And you're saying it's all very interconnected as well. So
Exactly.
you start solving obesity, that has a knock-on effect on eyesight. Talk to me a bit about disease prevention and how you're thinking about it at Roche. In 5-10 years, where could we be? Let's be super optimistic in terms of key diseases, no longer existing, I'm thinking along the lines of cancer, or maybe being hugely more treatable than they are now.
Yeah, so our aim definitely is to have a patient-centric healthcare, but we aim in the future to speak more about health, not about sickness. So in the preventive space, that would be very, very important. Now, there are a lot of factors that could play around that. One of the things that we are relying on is the technology when it comes to the genomic profiling. So by profiling the genomes, which is a very innovative technology, we will be able to understand what could be the diseases that the patient or the normal human could get in the future. We could understand as well how to predict like the manifestations of the disease. And we could as well utilize the certain technologies to understand how the certain compounds are gonna react into a patient's or a human body. With that, we can really prevent certain diseases. But it's a long way. And in order to reach there, you need to have a lot of efforts coming together, be it from technology, being the utilization of data, because data is a very important aspect of it.
And the responsible utilization.
Exactly,
of data as well.
Responsible and ethical use of data. That's why you need a lot of regulatory frameworks around it in order to utilize it. Even on the utilization of technology, you have to have like frameworks and ethics of using AI and technology. Because in general, the technology, you teach it, you make it learn, like the data that you are providing, and you have to have an equitable and diverse data in order to really speak to the whole population of the world.
And I want to bring Nosheen in there, particularly on the question of diverse data. You talked about having millions of data points that you've used to build your AI models. How did you go about ensuring that you had all demographic groups represented in that data?
Yeah, we have the very first study that we ran in 2018 to 2020. We made sure that we had quite a diverse group. We reached out. We had 26,000 people applied to participate in the study, and we chose about 1,022. We even had 2 unhoused people that were participating in the study. So we made sure we were demographically quite diverse. And then I wanted to back on what Olfa was saying. The future is here. So with AI, we can do multi-omics integration today. You don't have to wait 10 years from now. So if you have your genomic profile, if you have your lab data, if you have your wearable data from your Oura Ring or from your smartwatch or both, if you have your DEXA scans for your body composition, you have your microbiome data, any data that you have, if you have imaging data, you have MRIs, you have full body MRIs, et cetera, we are able to pull all of that data together and do multi-omics integration with AI. So my company, we've developed this product called the January Mirror, which is a multi-omic knowledge graph. So we can pull all this data together, and it can basically tell your future. So you know exactly what you're at risk for, you know exactly what's happening because we understand your lifestyle. We also we understand your genomics, but we also understand your phenotypes. We understand how you're living. And the combination of all of this data tells us, predicts the future of your health.
And when I'm listening to you talk about all these data points, it's amazing. It also feels quite overwhelming to be given all this information. Is there such a thing as too much information for the individual, the user?
There are some people, so the general view in the standard of care, at least in the United States, has been that, don't worry people for it. If they don't need to test, don't over-test, don't. But I think they've taken that to an extreme because like in the United States, half of the adult population has diabetes and prediabetes, and we don't screen for metabolic health. So I think it's irresponsible not to screen. But I think how much people want to know is highly, highly subjective, and it's personal. I want to know everything. There are some people who say, who cares? Because I think those people generally believe that they'll be healthy until the day they die. Unfortunately, that's not how it works out. You deteriorate over time. And my colleagues here who work in the larger healthcare know that we have a lot for cancer right now. We don't have a lot for neurological diseases. We have very few things for aging itself. The ultimate solution is how you live. Your lifestyle is really a huge contributor to your health. And the sooner people recognize their role in their own health, the better off we all are.
I want to talk for a second about costs of healthcare, and Leah, I'm going to come to you. So last year, tragically, very tragically in the US, we saw the killing of Brian Thompson, the CEO of United Healthcare. That killing became a flashpoint for discussion in the country and beyond about people's dissatisfaction with health insurance. What was your reaction to the scrutiny that insurers came under during that time?
Yeah, thank you, and absolutely tragic. We've stepped back and really reflected on it quite heavily as an industry, but also as Cigna. Our mission is to improve the health and vitality of those that we serve, right? We're very clear on that, and that is something that we take to every single market that we serve. And yet the dynamics and the ecosystems in each of the markets are very different, right? At the end of the day, insurance is funding health. And in the UK, where you and I are both from, you have a social healthcare system, and insurance sits on top of that, right? In the US, you have a basic healthcare access socially, and then the majority of the funding comes through the private health system or insurance or your employer through an insurance company, right? So that's typically how it works. And then all the way around the world, you have variabilities of those sort of private social type models. So I think that the reality is that boundaries have to exist somewhere. Where they exist and how they exist, I think, is the really, really important dynamic here. We've just launched, actually here in this region, not because we necessarily feel some of that same sentiment yet, but it worries me that it's possible. And it worries me it's possible because of a lack of understanding. So we're actually just in the process of launching a whole program around health literacy. And this is about helping improve the awareness and the understanding of health benefits and how to access healthcare and how, quite frankly, to get the most out of your health insurance coverage. It's not about encouraging people to claim less, but I go back to where I started at the beginning, which is I want people to spend their money or their insurance on the prevention, the vaccinations, the dental checks, the mammograms, the PSA tests. That's what we want them to do. And then over time, that will help improve health outcomes. The data shows that 74% of people who have high health literacy are much more satisfied with their health benefits. And 95% of people with higher health literacy are satisfied with their health insurance company. So it is a bit of a virtuous circle. It's imperfect everywhere across the world. I don't know if the fabulous ladies in the room here today have got a great example of where health ecosystems are absolutely perfect. I haven't found one yet. But I do think that, trying to fine tune and help raise awareness, back to what you were saying, Nosheen, it's about accountability, right? Health care and your health is not something that anyone else can do for you. You have got to take accountability for it. So I think that education and awareness comes into this. And then it's transparency and trust, right? I think that's a big challenge for the health insurance industry, is trust.
Yep.
And especially if this is a great big hole to go down into, but especially if you then take all of that data and you think about, how that could be used, and the responsibility for how to use that data to help improve people's outcomes. I hope that sort of
no, that was very thoughtful. Thank you for
it.
addressing that. Olfat, we were talking before we came on, and we've mentioned on stage about high obesity levels in the region, and you were saying how there are very clear goals set out by Vision 2030 here in Saudi Arabia to combat that. Can you talk a bit about that and how the country is progressing, what the main obstacles might be?
Yeah, so I think the one very important aspect is to start with the goal and the vision that is set in place. So once you have a goal, you feel that all the efforts are targeted and really geared towards addressing that goal and making sure that it's happening and creating like real KPIs around it. And we have seen a lot of projects that have happened as well here in the kingdom related to that aspect.
Is there one that you think is particularly effective?
I think one of the very important aspects is the encouragement, for example, of the lifestyle, where you see a lot of focus on sports and making sure that people change their lifestyles in order to progress on that respect. So it's not really a treatment, but it's really on the preventive side, on how to get people really active and have less sedentary lifestyles and really being on the preventative side. And at the same time, there's a clear kind of program that is geared towards treating diabetic patients early on in the process through awareness campaigns, through treating them early on. And there are many solutions that are already in place that will help get there.
I want to go to the audience. Do we have Katisha Ali in the audience? Raise your hand if you are here. Yes. Hello, Katisha. It's so great to see you. So you are the CEO and founder of Biosapien, which is developing 3D printed biodegradable implants to deliver targeted chemo directly to tumor sites, which sounds incredible. What do you see as the biggest hurdles to getting these sorts of innovations directly to patients at an affordable price point? Big question.
Well, first of all, thank you so much for the opportunity to ask that question or answer that question, I suppose. I think from our perspective at Biosapien, the biggest hurdle that allows patients to actually achieve access is the regulatory aspects or the financial aspects or the fact that I believe you talked about having insurance. Well, the reality is that 1/3 of the world doesn't operate on insurance and doesn't have the ability to pay for these therapies. So I think technology and having technology is amazing, but technology itself does not provide access. So how can we, I'll flip the question back to you guys, how can we make sure that technology actually doesn't get shelved, gets past clinical journals, and actually gets to patients in need as well, from your perspective as pharmaceutical, insurance, and founders?
So,
Nosheen,
yeah,
you go
so
first.
the average time between essentially what happens in the lab, so new science that gets developed in the lab, to when it gets incorporated into standard of care is about 17 years. And the reason is some regulatory reasons in terms of having to run a lot of trials. Some of it is just logistics, and there's a lot of bureaucracy. So I think to the extent that nations like forward-thinking and technology-forward countries like Saudi Arabia can shorten the time that it takes new science to go from essentially the bench to standard of care, that will make a huge difference. So what I mentioned, for example, for metabolic health, the AI is here, so why wait 5 years? So I think it's important as a matter of policy to be fast-tracking through the FDA, Saudi FDA, technologies that seem promising, and to be able to pass these on.
And is that happening, that fast-tracking? All facts?
Yeah, definitely it's happening. Like, for example, we have a very great example in Duchenne muscular dystrophy, where the Middle East was the second part of the world after the US in embracing a very recent technology that we have launched at Roche. So we feel the governments here in the Middle East are really embracing technology and innovation at the same time, and they are really utilizing all their efforts in order to make it happen. One other aspect that we feel is very much embraced, and this is part of our collaboration with, for example, King Faisal here in Saudi. We're working on what we call the value-based healthcare, which is one very important aspect on how to drive innovation in a faster manner, at the same time make it more efficient, more affordable, and with less side effects as well to the patients. So it's more targeted to the patients, making sure that it creates the value for the patients and for the ecosystem, removes all the inefficiencies that could come with it, and at the same time get the best results for the patients.
And Leah, I want to come back to you on Khatisha's point about the large portions of the global population that are not covered by insurance, and how we get this innovation and this progress to them.
Yeah, so for me, you've got to do two things. The vast majority of innovation in healthcare over the last 5, 6, 7 years has been pharmacological, right? As opposed to surgical, which is what it was in the past. Those pharmacological innovations, think the gene therapies, think even GLP-1 in its sort of new usages, have got a massive opportunity to impact and improve outcomes and health for a massive number of people. The challenge being affordability, right? Affordability for people or government systems to be able to buy in those solutions for their populations, or where insurance is concerned, the affordability of health insurance. I think two things have to run in parallel, right? We don't want to stop or slow down innovation, right? We want everybody to be able to benefit from the very best that is out there. At the same time, we as individuals have to take accountability for our own healthcare. Because if we just carry on down this route of thinking, well, there'll be a new something coming up, or I'm not taking accountability, or I'll be healthy until the day that I, drop, then it's unsustainable, right? So it is going to require a generally improved health status, which will reduce the disease burden, but then allow funding to be used in those cases that are, congenital or hereditary or not lifestyle type cases that could otherwise be avoided. So you have to try to, as a society, as a pool of people, we have to reduce that sort of current undertone of sick care in order to be able to focus the funding on the more complex.
I just wanted to add that a lot of innovations are paid by consumers right now. So we're not expecting insurance to pay for genome sequencing and things like that. A lot of people are just proactively, they're buying expensive food or they're buying expensive travel, but they're now buying expensive healthcare for themselves, deciding, I want to know if I have food allergies, for example, or I want to do my genome sequence, or I want to know my body composition because I'm having a hard time losing weight and I'm trying to figure out exactly what my body composition is. So I think this idea of proactivity, some of it is being self-funded, funded by consumers.
But I think, sorry, just a very tiny quickly, to add in and I agree with you, the risk though is that these really cool innovations and the things that will help us improve our health status are then only available
to the 1%.
to those people that can afford that, right? And as we think about equity, then actually do we risk broadening that equity gap?
And actually, when we talk about things like longevity, and we're going to talk about this in the next session, it's a very elitist conversation. Nosheen, just before we end, how much does January AI cost? What's
January AI is very inexpensive. There is a free version, and what you pay is like $50 a year. It's very, very inexpensive. We have everything that's available in the January app is available by API. So who's ever running any kind of apps of their own, Cigna, anyone else, can just throw in January AI into it. Also, the January Mirror, the multi-omics integration that I mentioned. However amount of data you have, that's also a B2B enterprise product. And that price we have, bring your own cloud. We also have a SaaS pricing.
Olfat, Leah, Nosheen, there's so much more to discuss, but thank you so much for being here. I hope you mill around and maybe speak to some of the women in the corridor. Thank you so much.
Thank you.
Thank you.